So continue from the last videos, this is the Optrogate. It has an outer ring, plastic rings, and it has an inner rings. The inner rings goes into the patient's mouth, and the dentist will know how to do it. Okay, and basically we will be protecting the mouth like this. Alright, so imagine the cheek will be protected by the Optrogate and the tongue will be protected by retraction. So we'll make sure that the cheek and the tongue is not getting cut. So we put that aside for now for demonstration purposes. Okay, and we start prepping. Okay, so imagine we're preparing tooth number 36. Okay, so while I put this 1.8 burrs on the surface, okay, we generally would cut away around about 1.8 millimeters. Okay, 1.8 millimeters of the tooth. Okay, so it should take a red band handpiece, and with water we'll be cutting this occlusal, which is a biting surface, once, and then we turn it to the other side, we cut it twice. Yep, okay, that's a very good demonstration of changing of suctions. The suction will always have to face the water spray, which is coming from the front of the handpieces. Alright, so after this we will then change the burrs to a smaller burr, a 1.2. Actually I prefer to use a tapered burr for now, the second one. Okay, alright, so and then we're going to come and demonstrate cutting on the side and also cutting off the in between. Okay, so with these burrs, actually let's do it like that. Okay, with these burrs, okay, you always have to come from the inside, okay, because this is where the tongues are and you can't come from the back of the mouth, you always have to come from the front of the mouth. Okay, and we'll be cutting the in between right here, resting and cutting. Okay, just making sure, usually the in between, when a tooth require a crowns, okay, often the in between are all fillings. Okay, and we'll just be cutting it away to clear the contacts. Alright, so this is the second burrs that we'll be using, the tapered burr. The third one that I'll be using is generally a 1.2, which is the smallest one out of this. Okay, the coarse burr right here. And what we're doing is we get suction ready, and we'll be cutting from the buccal area, all the way through the mesial, distal, palatal, and everywhere. Okay, that's the rough preparation done. Okay, it should only take about 5 minutes if everything is prepared really well. And then what we're going to do next, we're going to change it to the polishing burr. Okay, so we use the coarse burr, the first line burr, to cut the tooth. The second burrs is to adjust or to polish the surface. Whichever burr that I use to cut, I use the same size to polish. Okay, so when we clean the burrs, we arrange this accordingly. Okay, it's very easy. Okay, so the big one towards the big one, the smaller one towards the smaller one. Okay, and we change to the next fine polishing burr, and we'll be doing polishing. Can we do some suction, please? Thank you. So we'll be doing the surrounding polishing. All right, okay, so that's it. When we look at it, generally I will use a mirror, okay, to have a look at whether I'm happy with the whole preparation. Okay, after the preparations, we will need to work on getting the gum retracted slightly so that the impression material or the scanner can capture the surrounding of the tooth a lot nicer. So it brings us to retraction cord right here. So more than often we're using 2-cord technique, therefore we started with a 000 retraction cord and then followed by a 00 retraction cord. We have other videos that shows us how to cut this, okay, but in short, if we're doing a premolar, okay, we will cut it to here. If we're doing a molar, we cut it to here. Alright, and for demonstration purposes, I will pull this out and up to around about 3 or 3 up to 4. These will be what we'll be using for a molar. Okay, for the second cord, the bigger one, the less the number, 1 or 2